Thank you for joining us for the Par 4 Fitness webinar series. We hope you enjoy. Low back pain is one of the most prevalent injuries that we see on and off the golf course. Unfortunately, it keeps a lot of us sidelined from playing as much as we'd like to. And we're here to talk about some of the biggest things that we can do to identify what's causing it during your golf swing, but also some of the things that we can do to help you out with experiencing that low back pain. One of the things that we see a lot of with amateur golfers is extension of the hips towards the target. Now there are a lot of factors that go into it, including what this club face is doing. So we do want to keep that in mind, and it's always wise to consult with your swing coach as well. And then we're here to identify, okay, here's some things that we can do to maybe help with the situation if we are experiencing some low back pain. So usually for a right-handed player, the right side low back pain is probably the biggest thing that we see in the studio here. But also that's due to a mechanism during the golf swing that causes that injury. So usually what we will find for a right-handed player is in their backswing, they're maybe losing some of that posture, or they're leaning back towards the target too much. Now, as a result of that, what happens is in order to get the club face back to a squarer position and the club path back to more of an on-plane position, they will then arch back to the right. So they'll laterally side bend to the right. And as we do that with speed, say we're swinging 90 miles an hour plus, that becomes very aggravating for particularly the right side of the low back. And we'll demonstrate on a model exactly what that will look like. Here we're looking at a model of the pelvis. As we move to the posterior, what we will see is highlighted in blue would be the quadratus lumborum. Typically we'll have compensatory movement patterns through there. Moving down in the hip girdle, the piriform is highlighted in blue, and then the sciatic nerve that runs right underneath that inferior hiatus. And then out on the lateral portion of the hip, the bursa, which we can also have issues with. So some of the other things that we'll compensate with are the TFL, the sartorius, maybe rectus femoris there as well, and then the psoas and the iliacus, which are all highlighted in blue. These are all areas that we can have issues with during the golf swing, and you can see the yellow models are representative of the nerve roots that are coming out and moving down into the leg. Some of the things we want to take into consideration when dealing with low back pain are what's the mobility and what's the stability of different segments in the body. So if we start at the foot and the ankle, the foot is there to provide stability. When we move up to the ankle, that's a very mobile segment in the body. Knee is stable, hip is mobile, lumbar spine is stable, thoracic spine is mobile, scapula stable, shoulder mobile, stable elbow, mobile wrist. So if we take that into consideration, what we want to do is make sure that the mobile segments are truly mobile. And dealing with low back pain, a lot of the problem lies in the foot and the pelvis and the hips. So some drills that we can do to incorporate into our low back care routine, preventative and also getting out of pain, would be as follows. I am always a fan of stabilizing lumbar spine, and here's a great drill to put into your arsenal. So if you lie on your back, I'm going to press my lumbar spine into the table. I'm going to take one leg out straight, and the other one's going to come up towards my chest. Now I'm pressing really hard into the table, and I'm just going to switch. And I'm just trying to maintain that orientation with the pelvis, with the lumbar spine. And to add a progression into this, I can even go with the arms. So the full dead bug motion with that lumbar spine staying stable into the table. Another drill that we can add into the arsenal would be a side bridge. So what you're going to do is go onto your left side, and if you want to use this hand, that's fine. And you can do this on the floor so you don't risk falling off the table or the bed. But what I want you to do is press up onto the side. You can use the knees, or you can come up like this. And what I want you to do is try to hold that for 10-15 seconds. Now if you need to use that top hand, that's okay. And to progress this, we can go down and up off the table. So we're controlling lateral flexion of the lumbar spine, which during the golf swing is really important because we do need to have some amount of lateral flexion in the backswing and in the downswing. So if we have better control of it, the odds are that we're going to reduce the risk of injury or re-injury in the case of you've already experienced low back pain. Another drill that I like for lumbar stabilization, shoulder stabilization, as well as this reciprocal motion would be the bird dog. So it's basically a progression from the dead bug that I showed you earlier. And you're going to kind of start with this pelvic tilt. You're going to find relatively neutral position right in the middle. And what I want you to do is take your left arm and right leg out straight. Now what we don't want to see is any movement like that, any rotation, any arching through the lumbar spine. We just want to see a nice straight line from the fingertips all the way to my heel. And then what I'm going to do is switch. So I'm just looking to stay really stable through the shoulder, through the lumbar spine. A simple mobility drill that I'll do for the thoracic spine is the side lying open book. So if I roll onto my left side, support my head, I'm going to bring my knees up towards my chest to about a 90-degree angle. And as I do that, I'm going to rotate my right side back towards the floor, opening up this thoracic spine. So what that's going to do is gap the facets through that thoracic spine and give those nerve roots some room to come out the foramen. So it's going to be a great drill for stenosis, lateral or central, particularly on that right side. And you would do that on both sides. When addressing the hip, it's important to consider whether we've got a hip replacement. So some of the things that I will take into account would be the incision points, so whether we're anterior, lateral, or posterior lateral. Those cause different locations and complications with performing stretches. So keep in mind if we haven't had a hip replacement, here's a stretch that you can do. If you have had a hip replacement, please we'll do the next exercise with us. So what you would do is just cross the leg, and now you can push down, or we can pull up and across my right leg to the left shoulder. So I'm providing this force up and across, and I'm getting a nice stretch through my external rotators on the right side. So this would be something that I could hold for 4 to 6 breaths, a little longer, sustained hold. And what that's going to do is give us a chance to shut down some of the overactivity through posterior, so we can engage the internal rotators of the hip. and we would do that on both sides. Now, if we have had a hip replacement, this is a better drill to get control of our internal rotation, but also evaluate what's the quality of the internal rotation that we do have. So for golfers, say I'm a right-handed player, I want to be able to rotate about 45 degrees with this leg without my knees separated. So that's a good gauge for you. If you can only get to here, then there's something going on up at the pelvis that we need to consider. Is it arthritic, or do we have some muscle imbalance that's limiting that internal rotation? Or it could be anatomy related. So if we're anteverted, retroverted, that's going to play a role in how the neck of the femur articulates with the acetabulum of the hip. So what I'll have you do is go the other side. So I've got about equal amounts, 45 degrees on each side. And what I'll have you do is just do this windshield wiper drill. Where you take it out, a little bit of a hold at the top, and you're keeping the knees together. And you can use the hands here as a reference as well to maintain stability in the knee. So some simple things that you can add into the mix. So some simple things that you can add into the mix, into your exercise routine to help manage low back pain and get you feeling better on and off the golf course. Now let's discuss some of the swing fixes that we can address when on the range and getting out onto the golf course. The biggest problem with low back pain that we see in the golf swing is a combination of extension and falling back to the right for a right-handed player in the swing. So that can be caused by several things going on with the club face and the club path. But here's some simple drills that we can incorporate in your routine to help limit how much you are extending off of that line and losing posture and how much you're having to hang back. One of my favorites is getting set up, and you're going to pick something that's maybe 3 or 4 feet out in front of you, and we're basically looking for you to maintain posture on this line here. So as I rotate back, you're going to notice that my rear doesn't leave that line, and I've actually gotten my left shoulder lower than my right shoulder. Oftentimes what we'll find is players will do this and attempt to get deeper into the backswing, which only creates more issues. So I like this shoulder plane drill to get set up, rotate through, and then that just gives me a feeling for maintaining posture in my backswing and transitioning into downswing through impact. If we look at what's causing reverse spine angle, oftentimes I'll find players are trying to rotate more than they should, so they lose this angle in posture and the left shoulder gets way too high in the backswing. We see that on 3D, we see it on video, and it's a big problem. So what I prefer to see is we've all got to have a certain amount of rotation. We've all got to have a certain amount of side bend, lateral flexion, and then we've also have a certain amount of flexion and extension that go on throughout the swing. So for us, reverse spine is basically a loss of side bend and an overextension of the spine. Now that's not so problematic, it's what results after that. So as I'm up here, I've lost my posture. What I'll do in an attempt to save the club would be extend the hips and side bend to the right. Now as we showed you at the beginning of this video, that creates a lot of compression through the right side of the spine, through the facets, and it can impinge on the nerve roots that are coming out of lumbar spine and running down the leg. So it can create local pain or it can create radicular pain down the leg that can become problematic over time. So for us, what I like to do is actually, I will take the club in my hands. I'm gonna go palm up with my right hand, palm down with my left. And what I wanna see is, basically I create an angle with my spine and I'm not moving back in this direction excessively. Now we need that extension, but we don't want to overdo it. So what I like to see with this drill is we either stay centered or a little over. We're not overextending towards the left side drastically into the backswing and then transition. And what that's going to do is cut down on this need to get back to this position because we're already starting from a better one. So we're here, and then ideally we're just rotating down through the shot to impact. We hope you enjoyed this episode of our webinar series. Please subscribe to our YouTube account or like us on our Instagram pages.